Hello, welcome back to my channel in English for Nursing Communication 2. I am Ruffel Manalo from the Faculty of Nursing, Nakhon, Pathom, Rajabhat University. So this time I'm going to discuss to you the concept of writing in nursing part 4. So once again, this is a team teaching course in English for Nursing Communication 2 by the three of us from the Faculty of Nursing. So, uh, as discussed in the previous videos, that we have four major objectives in this subtopic in part 4. And the fifth one is that each student will review the concept and design a nursing care plan based on the case study I have uh, I have discussed in the previous video in part 3, and then the student will going to send that in the lecturer's email. So go further, review again the details that we have mentioned in the previous videos. And for you to do in the last part of this subtopic, I'm going to discuss to you about the nursing care plan. So, what is a nursing care plan, or we call it NCP? So, nursing care plan is a formal process that includes correctly identifying potential needs or risks of your patient. So, this focuses on the care of your patient. It also provides a means of communication among nurses, patients, and other healthcare providers to achieve healthcare outcomes. So we should always look forward on the positive outcome of the care we have given or implemented to every patient that we handle in the hospital. So these are the specific details we are going to discuss about the parts of a care plan. So in the nursing care plan, there is a nursing diagnosis, there is cues, there is objective, there is intervention, and of course, a reference is very reliable. So first here, the nursing diagnosis. This is about a clinical judgment of a patient response to an actual or potential health problems or life processes. So nursing diagnosis, we base this with the NANDA approach. NANDA. So nursing association. Later, I will discuss to you. But the name is NANDA. NANDA. And the next one, we just have cues. So in cues, you have there to include the details about the objective and the subjective cues. In the objective cues, these are the type of information that is collected from patients and obtain data of nurses through observations by seeing, hearing, smelling, and touching, while subjective are type of information obtained from patients telling a nurse about something that your five senses cannot measure. So take note. Subjective is from your patient's information, personal information that they will give to you as a nurse on how they feel, that you cannot see, smell, you cannot hear, and you cannot touch. So that includes their feelings, their emotions. And objective cues, these are the things that are seen, heard, you can smell, you can touch to the patient. Okay. And let's go to objectives. So in objectives, there are two types. You should have a short-term objective, which lasts for like hours, 2 days. And long-term objective, this lasts for like weeks, months, years, or decades. So these are the objectives that is the basis that are the basis of evaluation for nurses in order to achieve a certain goal on the efficiency of nursing care at a specific time frame. So it should always be time bounded. So let's say, for example, your goal for the patient's fever is to decrease within 4 hours, within 8 hours, or even within an hour. So you need an objective. Next, we have the nursing interventions. In the nursing interventions, there are also two types. We have the independent nursing interventions and we have the dependent nursing interventions. For the independent nursing interventions, these are the actual treatments, procedures, and actions performed by the nurse to reach the goal that are set for their patients. Okay? So the nurse can do it alone without the doctor's order. So because that is the responsibility of a nurse. While dependent nursing interventions, these are the treatments. Okay, so what are the treatments? Let's say, for example, um, uh, doctor's order about medications, doctor's order about intubation, doctor's order about chest x-ray. So those are dependent nursing interventions and is carried out by the nurse. So always remember, nurses are the backbone of a hospital. The hospital cannot operate without the nurses. So these are interventions, independent and dependent. And of course, as what I have mentioned, a reference is very important because you need information or details from reliable resources like books, internet, on how you are going to care of your patient, especially the current and effective nursing care or interventions. So this is how your nursing um, care plan looks like. That's according to John Hopkins Hospital. Okay, but I think this is universal. So wherever we are in this world, in this universe, we use the same care plan, different format, different languages, but we have one common goal, which is patient centered. So to conclude, writing summarizes the main points and draws ideas that are interrelated in the assessment, diagnosis, planning, implementation, and evaluation of patients using the step-by-step process. So this is how your practice tests. You have to design a nursing care plan, okay, and you have to submit that in your lecturer's email address. So as what I have mentioned, our case study is the same as the last case study we used in part 3 of your part 3 and part 4 of this subtopic. Okay, and this is the format, okay, that we're going to use. So only use this format. You can write this in your either iPad, in your computer, or in your lecture notes, and then you can send it to your lecturers. So thank you very much. And if you have any queries, please don't forget to send me a message through my email, line, or messenger account. So see you next time.